Mr. Speaker, I fully echo her tribute to our amazing NHS workers, and it is in order to protect them and to help them that we are taking the extraordinary measures that this country is, and I repeat my advice to the nation, which is to stay at home, protect our NHS and save lives.
Jeremy Corbyn.
Thank you. Thank you very much, Mr. Speaker, and thank you for making the best arrangements possible today to ensure that as many members as possible can ask questions, but also that the government is held to account, which is what the function of Parliament is. Many more people will be mourning the loss of loved ones as a result of coronavirus this week. Our hearts go out to all of them and to those suffering from the disease at the present time. Across our country, people are working day and night to keep us safe, fed and warm. Our wonderful NHS staff, police, firefighters, prison and probation workers, teachers, civil servants, local government staff and social care, all of them are showing the value of public service. They are the unsung heroes, keeping the transport system running, the post delivered, utilities running and our supermarkets properly stocked. I'd like to pay special mention to one group that are usually ignored, forgotten and decried as unskilled workers: cleaners. All around the country and in this building are doing their best to keep our places hygienic and safe. Over the past few weeks, I've asked the Prime Minister many times what action is being taken to ensure testing is being prioritised, and I've received assurances that everything that could was being done. Yet, Mr. Speaker, a leaked email shows it was just 3 days ago that the Prime Minister wrote to UK research institutes to ask for help, saying there was no testing machines available to buy. Why wasn't this done weeks ago, if not months ago, when the government was first warned about the threat of a global pandemic, and what action is now being taken to get testing machines?
Mr. Speaker, perhaps I could begin by pointing out that this is the Right Honourable Gentleman's last Prime Minister's questions, and it would be appropriate, I think, for me to pay tribute to him for his service to party and indeed to the country over the last 4 years in a very difficult job. We may not agree about everything, but no one can doubt his sincerity and his determination to build a better society. And I want to pay particular tribute and thanks to him and all his colleagues for their cooperation in the current emergency as far as possible across party lines. I agree with him very much in what he said about cleaners. They do an extraordinary job, and they deserve all the protection and support that we can give them in this difficult time. And on testing, he is quite right that testing is vital to our success in beating the coronavirus, and as the Health Secretary has explained many times, we are massively increasing our testing campaign, going up from 5,000 to 10,000 to 25,000 a day, and in answer directly to his question, this has been a priority of this government ever since the crisis was obviously upon us, for weeks and weeks.
Jeremy Corbyn.
I thank the Prime Minister for his very kind remarks. I believe in a decent, socially just society. And he was talking as though this was a sort of obituary. Just to let him know, my voice will not be stilled. I'll be around, I'll be campaigning, I'll be arguing, and I'll be demanding justice for the people of this country and indeed the rest of the world. We can only protect the health of us all, Mr. Speaker, if we protect the health of our carers. Yet the charity Sue Ryder, who provide care to people with neurological conditions, have said that their workforce is depleting daily as they have no access to tests. When will all the social care staff have access to regular testing? They are very, very important and obviously very, very vulnerable in this crisis.
He's entirely right. I don't want to repeat what I've just said, except to say that social care staff, in common with NHS staff and indeed other public sector workers, need to be tested as fast as possible. And the answer to his question is we will do it as fast as possible.
Jeremy Corbyn.
Obviously, if they have to self-isolate because they suspect they have the disease and can't get a test, then their work is lost for a week. and obviously those that need the care and support don't get it at that time. There are reports that care homes workers are being turned away from supermarkets in relation to priority shopping, not being allowed to buy more than certain items that they desperately need to feed their residents. What is the Prime Minister's plan for making sure that care workers can get the vital food and supplies they need for the people that they're caring for?
Well, Mr. Speaker, as he can and the House can imagine, we've been in regular contact with all the retailers, all the supermarket chains. I had a conversation with all of them a couple of days ago, and they were absolutely determined to ensure that key workers do get time in supermarkets. If there is a particular problem, I will raise it with them again.
Jeremy Corbyn.
I hope the Prime Minister will, because care workers are on the front line looking after the most vulnerable people within our society, and keeping our care homes safe and well should be and must be an absolute priority. The Prime Minister has been saying for quite a long time that NHS staff will get the equipment they need, yet the Healthcare Supply Association, just get that, has been forced to use Twitter to ask DIY shops to donate protective equipment to NHS staff. This is an appalling situation. When will NHS staff, social care staff and community nurses and all other staff relating to healthcare get the PPE equipment they absolutely, desperately need?
Well, Mr. Speaker, I can tell him, and he's absolutely right to raise this issue. I know this has been a concern, and we had a long meeting on it this morning, but I'm assured that not only are the stocks there now, the Army is now distributing the supplies to all the NHS staff, all the hospitals that need it, and in the last 24 hours, they have distributed 7.5 million pieces of equipment.
Jeremy Corbyn.
It's important they get it, because yesterday 77% of NHS chiefs who responded to a survey said that the lack of staff testing and staff shortages were the two biggest areas of concern for them. Last week, the Prime Minister stood in this chamber at the dispatch box and said that he would, and I quote, protect private renters from eviction. He absolutely said that. Yet, some renters will be getting eviction notices as early as next week. The Prime Minister appears to have gone back on his word. So will he now finally absolutely ban evictions for 6 months in line with the renewal period of the emergency legislation which is going through its parliamentary process at the moment?
He raises a very important point about the need to protect renters, which is why I answered in the way I did last week. We've actually gone further now, as he knows, by lifting up the local housing allowance to the 30th percentile of median rents, which will be very important for many people on low incomes across the country. But we are also, as he knows, making sure that no-fault evictions are no longer legal, and that is part of the bill.
Well, unfortunately, this isn't what the reality is on the ground, as many of my colleagues will point out. We are getting constituents in touch with us who are being threatened with eviction now because they are in rent arrears, because they cannot work because of the shutdown over coronavirus. Can we just be absolutely clear, and will the Prime Minister make sure it's legislated that nobody can be evicted during this first 6-month period of this emergency from the private rented sector? I'm going to continue my questions shortly, Mr. Speaker, in the second part of this session. But I just want to ask this question to the Prime Minister. Many British people abroad feel a bit abandoned by their government, with many fast running out of medicines, with the host countries in lockdown, flights being cancelled, accommodation cancelled, and insurance either about to expire or not covering the much needed costs until they're able to return home. These British citizens have a right to turn to their own government for help, and hour-long delays on phone calls are not acceptable. They feel abandoned. Can the Prime Minister, as the Foreign Secretary was asked to do yesterday, update the House on what his government is doing to bring people home and provide the emergency costs for the medical needs that many British residents abroad actually have at the present time?
Mr. Speaker, he can take it that we are certainly doing everything we can to bring back British nationals, British citizens from abroad. A huge operation is going on now to repatriate them, as he will have heard both from the Health Secretary and indeed the Foreign Secretary, where we are protecting renters in spite of what he says. We are doing everything we can to protect our fantastic NHS. We are putting, as a society now, we are doing and as a country, we are doing a quite extraordinary thing, which is for the first time in our history, to get through this crisis, we are putting our arms as a country around every single worker, every single employee in this country. And it is a quite unprecedented step, and he will be hearing more. And I know there are concerns about the self-employed, but he will be hearing more in the next couple of days from my right honourable friend, the Chancellor. I can tell him that, and I think that he said something the other day about this, how this country would come through this experience changed for the better. And there he and I completely agree. And we will get this country through this crisis with these exceptional steps, and I can tell him that we will do absolutely everything that it takes. We will do whatever it takes to get our country through it together. We will beat it together. But the most important advice I can give him as he retires to his, I'm delighted to hear he's not retiring. And I think that'll be warmly welcomed by his successor. The most important thing we can all do is stay at home to protect our NHS and to save many thousands of lives.